Hello and welcome another day on the program. It's day 5 on the countdown to the Health and Care Worker Visa UK 2022. And today I want to answer some questions that you have sent my way. A few of them have been, they've been coming and I thought I'll just address them. So today I'll be answering 10 of them in particular. Firstly, you want to know about the visa. Is it the same as a skilled visa? So is the Health and Care Worker Visa the same as a skilled worker visa? Well, no, it's not quite the same, because with they have the same elements, but actually with the Health and Care Worker Visa, the United Kingdom is trying to make it slightly more attractive for yourselves to fill the gap in the occupation shortage in the country, which is the healthcare industry. So what they have done is that they've made it cheaper, 50% cheaper, so the visa fees are reduced. They made it fast-tracked, so 3 to 6 weeks as opposed to, what's obtainable really. And also they made sure that they can attract you by saying we have a dedicated team, a UKVI team that will see to the application process and make it quicker. And then lastly, they'll be waiving the health and immigration surcharge, which is quite a lot of money for most people. And this will be waived. So it's different, okay? And you can get up to 3 to 5 years. It's a route to settlement. You can renew it, etc. So that is the difference between that, but pretty much the same. Second question, you want to know if you need experience for this job. Well, initially, and I say initially because things are changing every day. It's a very fluid situation, as we say. Every day we're hearing new things, and it's being tweaked. So initially, the advert was saying you don't need any experience, you don't need qualification. But what we're now seeing is that most of these recruiting agencies, the healthcare, the whole healthcare settings are now starting to say, well, actually, we would like for you to have experience, but if you don't, it's okay, we'll train you. Now, it's a bit vague. So it is factual that you don't need it. It's not an absolute must to get the job or to come into the country. But if your employer is saying that I wouldn't mind if you have these things, then the point is, if you can do it, then do it and up your game and be the one that they actually select for the job. So there are different ways you can get the experience. Obviously, you can go get the job in your home country and try and build up experience. Beware though that some of this especially the recruitment agencies, or should I say the healthcare agencies actually, because you're not allowed to apply via third parties, but the agencies that are applying direct seem to be saying that they want a minimum of about, thereabouts, not all of them, 6 months experience in healthcare. And they also want it to be paid employment. So you need to check very well your vacancies that you see out there, and you need to check what the requirement of that particular employer is, because not everyone is saying the same thing. Some care homes are very, very happy at level 2. Remember, level 2, the care worker. They don't mind for you to just come in, as long as you're willing, you have the passion and all that. You come in and they will train you themselves. Whereas some bigger agencies and some bigger settings are saying, well, no thank you, you have to do this and that before you come. So with the experience, that's the answer to that. It varies for everyone, but of course, if you can get the experience before you come, even better. Third question I've been asked is, do I need an IELTS, the English proficiency, to come into the country or to get the job? Either way. Well, the answer to this is yes, you do actually, because the United Kingdom itself needs it. It's not just your employers asking you to do it. It's also the fact that for the visa process itself, it's one of the things that's been recommended there or been listed there. So it's and remember, it's the UKVI test, the UKVI IELTS, that is specific for general or academic, that is specific for the visa and immigration. Okay, so UKVI, yes, United Kingdom Visa and Immigration, is the IELTS test that you need to do, the English proficiency. And I would say try and get that, because also if you want to do anything further on, it's used in the country. If you want to do anything further on, you can do that. Remember, it lasts for about 2 years, so you might have to renew it, and the embassy would want you to have an overall result of 5.5, and so your employers are asking for that. Some of your employers 5.5 overall and above. So, but if you don't have that, you can also have the ENIC. So it used to be called NARIC, but that is the UK ENIC now. So where you have the comparability with your degree. So the degree that you've earned in your home country must be taught in the English language. That's really important. Do not forget the transcript and everything, or you'll be willing to have it translated to the English language. So you can go on the website. Once again, the website will be here at the bottom somewhere, and then you can go in and find out if you can have that compared. And you should be able to do that in about, 3 weeks thereabouts. So if you have a degree, you don't necessarily need the IELTS. But if you ask me, if you're planning to do much more, further study later on when you're here, if you're settled, etc., or you want to maybe get a more senior job, especially with that, I would say if you do have the time, do the IELTS and come with it. So if you don't have the IELTS, you have your degree, all right? Degree and up and above, of course. If you have your PhD, master's, fantastic, first degree, you know what I mean. The number 4 question you've asked me is, can I extend my healthcare visa? The answer is yes. Actually, the initial length is for 3 years, all right? And you can renew this annually. So your employer will help you with that one, and you renew it annually, and you can get up to 5 years. After which, if you desire, you can go ahead and apply for your indefinite leave to remain. And by that point, you would have met certain criteria. By all means, speak to an immigration expert, because I'm not one, and you can understand these things better. All right, but yes, it can be extended. The 5th question is asking, can I bring my adult children? So the UK allows you to bring your children, your dependents, from the age of obviously 0 to 18, so 18 and under, and they can come with you and your spouse, and you can move to the United Kingdom on this type of visa. And also from the ages of 16, there are a few more requirements. So there's a documentation you have to provide from 16 to 18. You need to have for your children, obviously 18 and under, you will need to also have some maintenance to show your accounts, some financial requirements of maintenance of about 300, and I believe it's £315 for children, for your dependent child. All right. So obviously, if you have more than one, you know what to do. And then which leads nicely to the other question, can I come with my spouse? Yes, you can come in with your spouse. And you wanted to clarify, someone's asked about, the thing about partners. Yes, so there is mention of your partners. And your partners, people wondering what is partner, is a term that is used here for the person who you're cohabiting with, long-term relationship, a genuine long-term relationship of someone. There's a qualifying period, by the way, it's 2 years. At least 2 years you've been in that relationship with that person cohabiting. And for when you speak to the immigration experts, I'll explain this better for you. They'll probably be saying things like, you will have to prove that yourself. All right, the thing with the immigration system here is that Britain makes you prove it. You can say whatever you please, but you have to show the evidence for it. And the onus is on you to provide that evidence to convince them that what you're saying is true. So they're not going to tell you, give me 5 things, and then I'll believe you. It's a case of bring what you have, and then I'll have a look at it, and I'll see if you're telling me the truth. So that means that if you know that you are in this relationship with this person who you're not yet married to, so for example, what you call your fiancé, perhaps, or someone who you're just being in a long-term relationship, in a genuine one, then you have to throw everything at it. You have to show things like you're supporting that person, they're dependent on you, there'll be financial requirements, things like that. But by all means, speak to those who are trained in things like that, because that's not my field. And there's a fee as well. There's something, or rather not the fee, there is a financial requirement as well. So for your spouse, you will have to show financial evidence, £285 for your spouse. So obviously, if you come with your spouse and your child, then you start to add up that money. The next question you wanted to know, your number 7, is, do I need a driver's license? A significant number of your employers, your future employers, are saying that you need it. Because for those that want you to work in different settings like home care, domiciliary, so some want you to travel from one client's home to the other, because those are working in the community, they require you to drive. They require you to go around. It depends on where you be. It depends on the vacancy that you find and what the employer is asking you to do. But my advice to you is that if you do drive, I would say make sure you have your your international driver's license up to date. Make sure it's got a photo, because they insist on a photo card, and you bring it over here, and you have about 1 year, a 1 year window in which you can convert it to the UK one. So that you don't limit yourself, because for some of you, you're going to require that for your jobs, and of course for your everyday living, perhaps to move around and do other things. So yes, I would say yes. Most of the vacancies are asking for that, because there's a lot of vacancy in community care. You see, so there's lots of jobs in general, but there seems to be more need around the community care workers and those domiciliary care, stay living care, and these people will require to have a car, mobility as they say, to take the service user out, maybe to the shops or whatever. You need to be the one to drive them there. So there'll be a lot of things, and they do pay well. So you're going to see that they want, if they're going to give you a bit more, you're going to have to also give something in return. So for the better paid jobs, they seem to be wanting you to do the extra a little bit more. So not just the personal care, but actually maybe to socialize, to help the other person go out there and live their lives, in which case you need to drive them to the shop, or you need to drive them to their appointments, the hospital appointment. So if you're going to be doing this, of course, I would advise that you bring it. It's not compulsory. Certainly the embassy is not asking that you do that. They're not saying that if you don't have that, then you won't get a visa. No, that's not what they've said to you. It's actually the employers and the type of vacancies and the demands and requirements are saying, this role you're applying for, that I intend to pay you this amount of money for, I want you to have your driver's license and be able to mobilize. And number 8 question, do I need to be vaccinated for COVID-19? Very short answer, yes. Yes, you do. Right. So, compulsory at this point that I know of. So most of the employers have made it very clear. There is no discussion. You have to be fully vaccinated in the home, especially the care homes. So in the care homes, you have to be fully vaccinated to work with their vulnerable adults. And then for the UK government, by April 1st, 2022, they're proposing that all healthcare professionals, key workers actually, but healthcare professionals in particular, have to be fully vaccinated. So yes, you do have to do this. So I would advise, when you're intending to come, what other plans you have in place, and the requirements you're trying to meet. So I would advise that you go ahead and start, at least have your first job, and then 8 weeks later the second one, if you're going to have a booster as well before you come. All right, so you do need it. Number 9 question. Someone's asked, or a few people have asked, can I start my nursing degree straight away in the job? Now, this is actually a very good question for the immigration expert. Nursing degree in the United Kingdom is funded by the NHS. The NHS BSA, I believe is what it's called. You can check their website and you will find out that there are some requirements. All right. One of them is residency. So you have to be a home student, as we call it. Not an overseas one. You have to be a home student, and that there's a definition for that. You have to have had residency for up to 3 years before you qualify. There's a bursary tied to it, there's funding tied to it, there's loans, and so because of all these things, there's a requirement for you to meet that. It's not for everyone. So you coming in without any other thing, just that the care visa, the health care visa, and you wanted to start your degree same time as you're working, you're going to have to speak to an immigration officer about that one. But I'm fairly certain, and there's a requirement period, and it's 3 years residency, and it is funded by, I think it's fully funded by the NHS BSc. So do have that conversation. And lastly, the question I've been asked is, can I move into something else? Can I work somewhere else? Can I come in, but then I can? Well, okay. Once again, good to get expert advice. But the thing is, you can change your visa type. If you go on the website, the Gov UK website, it talks about things like that, the instances where you can change your visa. The caveat is that if you're going to change your employers, because your visa is tied to your employment, remember, your employer is your sponsor for that period of time. So if you are going to change for any reason, you have to change within the same sector. So the health sector, you can change your employer, and that doesn't require a fresh application. Anything outside of that, you will have to do a fresh application for that visa type. So this is where, once again, I repeat, the immigration experts will help you with that one if that is your intention. Or if you're not intending to do that, you just want to know, in the future, if you wanted to do something different, just remember that you have to be sponsored for that period of time. So you're coming for the first 3 years, you can extend it up to 5 if it is your intention to stay. Then you need to know that you will always have that sponsor till you actually qualify for your indefinite leave to remain in the country. So you can remain in the health sector with the same employer, but if not, if you intend to leave that employer and leave that sector, the health sector, health and social care sector, you will have to do a fresh application. It's all on the website there, so have a good read, the gov.uk website, and they will tell you more. So thank you. I hope this was helpful to you, because I've had a few of these questions. I thought if these ones are asking me, there are probably others who want to ask the same question. So I thought I'll address the 10 of them today. Hope it's been helpful for you. Don't forget to like this video, comment, share, subscribe, and I'll see you on the next one. Yes, take care. Bye.